Okay, I'll keep my eye on the lobby and admit people as they come in. But thank you so much for taking valuable time out of your day. We're really excited that you're here. We're excited that you're a part of this movement, part of ShadowNurse, and part of this premium experience. And it's really all about you. So we're gonna try to get some of your questions answered today. And this is the formal introduction to the first ever ShadowNurse Fireside Chat with your host, ShadowNurse co-founder and CEO, Olivia Svrchek. I'm Jeff Pollard. Nice to meet all of you. As far as procedure-wise, we're keeping participants off mic for now. The chat should be open to communicate with us as the host. If you have questions that come up along the way, we can try to work those in. If you're having difficulties or something, post them in the chat. Let me know, and I can try to resolve those as the MC and IT person for today's chat. Getting a couple of hellos from people. Thank you so much. Some familiar names and faces out there, and some new ones that we're getting familiar with too. So welcome to everybody. Today's fireside chat will serve as a more personal and casual. We're going to keep this as casual as we can while we try to deal with the technology. But to serve as a more personal introduction to ShadowNurse and cover the topic of interstitial healthcare, which we brought up through the newsletter and email communications recently. We want to fold in some elements of the patient journey into that and get through as many of the questions as we possibly can. Let me do a quick check on the lobby. And I think maybe this is a good time. I'll pitch it over to you, Olivia. Why don't you start with a brief introduction, and then I will queue up the questions for you.
Sure. Hi, everyone. I'm Olivia Svrchek, co-founder and CEO of ShadowNurse. So happy you all could join us today. So I'm a nurse practitioner. I've been in nursing for about 15 years now. No idea where the time has gone, but grateful for my journey and grateful to now be at the head of a company that I believe is going to revolutionize healthcare and the nursing profession. And let's see, how did I get here? Well, I applied to my first job as a nurse, got it in bone marrow transplant, and then, it all went from there, right? So worked an inpatient for a few years. Really right off the bat was curious about how to make the whole thing better. I'm sure all of you feel the same way. But there's just a lot of lost information, and I caught on really quickly to the nurse being the one that connects all the dots, right? We're a fly on the wall when the doctors are doing their consults, when we're overhearing the patients recap what they talked to the doctor about that day, and mess up half the information as they're trying to talk to their family about it. And fast forward, 15 years, that same thing happened in all of my jobs, inpatient, outpatient, in clinical research, even in my role at, in medical affairs at 23andMe and at other tech companies. The nurse always was the one ensuring that accurate and full information was being conveyed to the patient and to the providers and their family. So I pitched this idea to Jeff a while back now, and we've been working on this hardcore. I don't know if anyone else has started a company, but you go through ups and downs, and you have to pivot and you test things. And, we're in a really solid place right now. We have 2 engineers working on our MVP app, which we'll get more into, I think, in this conversation. I'm pitching, venture capitalist firms for funding. We are learning more and more every day through, the patients we are serving about how to do that best. And yeah, it's super exciting. And now with the implementation of this, premium group and the newsletter, we're really starting to focus on our nursing community and the nurses, that we want to bring onto the platform once that launches, which should be within the next couple of months for our, MVP platform. So fast-paced, true startup. I haven't seen another company like this in the nursing world trying to really disrupt what nurses can do from home in a flexible manner, and really put them in a position, put all of you guys in a position to impact patient care like none other from your home as much or as little time as you want. So yeah, glad you're on the journey. Jeff?
Yeah, so one of the first questions is, you mentioned in some of your communications and on LinkedIn and other posts that you're really doing this as much for nurses as for anything. And can you kind of go into that a little bit more? How do you see that becoming a part of ShadowNurse, and how is that driving the decisions you're making and the things that you're building?
Sure. Yeah, that's a loaded question. I could write a big novel about that. But I think the main driver for me is nurses do so much more than what our current system can capture, right? We have to enter documents in an EMR or, go to some meetings here and there, but the bread and butter, like the magic that happens with nurses and their patients is widely not measured and not captured. And it hasn't been for a very long time. I read an article that, someone on LinkedIn posted, one of the women I follow that's a nurse leader, about how nurses in the very beginning did kind of practice independently. They did their own thing. They would, get in connection with patients and families in need. They'd go to their homes. This is in late 1800s all the way up to like 1910, I think, if I remember correctly. But it was very much independent. And if they charged a fee, it was directly to the family, to the patient. And they would go to hospitals and charge separately from the hospitals. And somewhere in there, the hospitals decided, oh, it'll save us more money, or it would just be better if we hired the nurses, took them out of their independent, self-employed kind of environment, and then roll them up into our services. And so 100 years ago now, nurses became bundled into this fee that really erased a lot of what we brought to the table. And I feel very strongly that that's still the case. I most recently worked at Stanford, one of the leading institutions in the country, as a nurse manager. All, but really, where is the value being captured here? And so when I think about ShadowNurse and the opportunity to build our own EMR, essentially our own platform, we get to decide, me, you, and the nurses on the team alongside the engineers, what information is most valuable, what information we need to capture that the nurse is doing. And really the goal of ShadowNurse is to not miss any information, right? Whether that's what the patient is seeing and learning and getting from it, or what the nurse is bringing to the table. So it goes both ways. If the patient remembers to take their medication, it isn't just, oh, they took their medication. It's, we do capture what the nurse did to enable that patient to take their medication. So, my main motivation is to create a world that nurses, the nursing profession and what nurses do, is 100% captured, accurate, and reimbursed, paid for, valued in our society.
Awesome. We have a couple of questions coming in that are kind of getting specific to the platform. I'm going to circle back on some of those in just a second, but let's kind of introduce a little bit more about shadow nursing as a concept. Maybe you could describe the concept for everybody in a little bit more detail. Like what does it look and feel like in terms of what would a day in the life of a shadow nurse look like? And is it really just healthcare navigation? Is it healthcare navigation plus some other things? Is it something else completely? And then we'll kind of dive into the tools that maybe we're building from there.
Okay. Yeah, so I can almost guarantee that nurses know inherently what shadow nursing is, right? It is a new term. We are trademarking it. And in essence, shadow nursing, is the nurse kind of in the background, making sure that patients get the best care possible. I'm learning that I like to steer away from the terms healthcare navigation. I didn't know that in the beginning, when we started pitching this to people. But healthcare navigation kind of pigeonholes us into this world of what is healthcare navigation per like Medicare, right? Or what, again, in the reimbursement world, what metrics do we need to meet to get reimbursed, right? And that limits us. So when we talk about shadow nursing, it isn't just healthcare navigation. It's probably the easiest way to help, lay people understand what we're doing. But as shadow nurses, we know that it's much, much more than that. And that's what we're building. It's what you do. So I'll say an example. So, and every nurse has done this, right? We've all done some sort of care navigation advocacy support for friends and family, or even patients that need it, that we know, what we're doing from the 9 to 5 isn't enough, or on my shift, I know that they need more follow-up. So I'm going to go above and beyond and, call them outside of my shift and make sure that they get the help they need. So my mom, for example, she has really bad chronic back issues, and I've been care navigating for her, shadow nursing for her now for a couple of years. But one moment that really stood out to me, I know my mom, right? So I know I can read her, I can understand her, I know her health literacy, I know her family dynamics, I know where she lives. She lives 45 minutes away from where she gets care. So number one, shadow nursing is about getting to know your patient. Okay, way more deeply than, a siloed kind of one encounter can in a healthcare system. That way you can help them navigate in a much deeper and thorough way. So she had to go to her visit. We had a pre-visit call. So that's something that shadow nurse is doing that is very helpful, but really take 5 to 10 minutes on the phone or on Zoom, however, the patient prefers, to recap why we're going to the visit. What are our main questions? What do you hope to get out of this visit? And also so that you as the shadow nurse during the visit can, best advocate and make sure everything gets done. During the visit, you call in on your phone, on the patient's phone. They will call you. Right now it's directly, it might stay that way. It might be through our app, to be determined. But right now they call me, right on my phone. My mom calls me, and I've been talking to her about a specific procedure that I know about because I'm in pain management as a nurse practitioner. And the provider doesn't recommend it, or, doesn't bring it up. And I know that this is what she needs. I've looked at her MRI, and if the patient shares their medical records with you, you can absolutely look at their reports and get a comprehensive look at their medical history and MRIs that come up. So I had already looked at her MRI. I knew what I would recommend. And, that's me as an NP and her daughter, right? There's a whole scope thing that I'm sure you guys are thinking about right now that we can talk about later if you want. But she doesn't bring it up. So as her shadow nurse, I had an opportunity to bring up the specific procedure, ask questions. It's an ablation. You guys probably know what that is, but nerve ablation. And, so I got to ask questions, and fast forward, she's getting a nerve ablation in next month. There were several steps we had to go through, but this is the first time that she's felt like there's a plan in place. There's something that, there's some hope, there's a procedure that maybe can help her back pain. And I know for certain that if I didn't call into that medical visit and had some sort of medical knowledge, then that wouldn't be part of her treatment plan. And that's a very condensed version of the story, but that same story where a shadow nurse is in a visit, knows the patient and can advocate, has significantly changed the course of a patient's treatment. Whether it's speeding up time to getting medications, advocating for a different type of medication that might be a better fit for the patient. And then after the visit, of course, I know when the follow-up visits are. I have a kind of debrief call with my mom, make sure she understands everything. That information is documented. Eventually it'll be in our app. And then she can text me or call me with more questions instead of going to Google, or having to call the doctor back and try to get more information, which we know is a nightmare. So yeah, it's their personal concierge in a way, advocate, medical expert that they can access outside of the medical system, which is novel.
Thanks. So something kind of related to what you were just talking about. In the traditional sense, a lot of the brick and mortar healthcare navigation happens as somebody's transitioning perhaps from a hospital setting to at home or another facility, or received a new cancer diagnosis, for example. And oftentimes those relationships are probably shorter lived than we'd like them to be, maybe on the order of weeks or a couple months or so until somebody kind of gets transitioned. What's the advantage that ShadowNurse has over that, that method of helping somebody navigate? And how does that long-term relationship kind of play out? How do you stay kind of embedded in a family or in a patient's journey for a long period of time? How's that playing out with ShadowNurse?
Sure. You guys are asking many questions in one.
Yeah, I'm kind of like weaving questions together. So
Okay. All right. Got it. I'll do my best. If I miss a piece of it, then feel free to bring it up. Well, healthcare inherently is siloed. And what you just described is a siloed way of providing care navigation, right? It's episodical. It's when people are in a crisis, they realize that they need help. The system realizes that they need more to provide more support, and that's how it's been designed. Shadow nursing is very much about preventing hospitalizations and preventing people from getting to that crisis state, where they have to tap into the hospital and resources that they otherwise, couldn't have. So by creating a longitudinal relationship with somebody, we can identify patterns. We can get to know red flags, right? We might say, oh, okay, my mom, right? Her pain's getting worse and worse and worse. I think she's probably going to go to the emergency room if we don't get ahead of it, right? The shadow nurse's goal is to become the first call, right? Of course, if it's an emergency, call 911. But I want my mom or my patients to text me, call me if you're starting to feel like something's off, or vice versa. I know that there's something going on. I'm going to check in more often with my patient. And because you've built that rapport, because they have a trusting relationship, not just with you, but with Shadow Nurse, the company, they believe in the brand, trust the brand, trust what we're delivering. They're going to be more likely to use us first. And then we can get ahead of, the ER visits, the hospitalizations, the downhill slope that kind of then puts the healthcare system, where it's meant to be, right? Which is emergency and crisis care. On top of that, what we're finding is you don't just build a relationship with the patient, you really get to know their whole ecosystem. You get to know their partner, husband, wife, their family, if they have kids in the area that can go check in, on mom or check in on grandma. And by knowing those connections that the healthcare system typically doesn't pay attention to, unless it's part of the conversation that probably the nurse is bringing up at the bedside, it's really missed. It's really a missed opportunity to leverage other support systems that exist and help prevent crises. So we get to know much more than the patient, and that creates this safety net, if you will, for our patients and the family members that we're helping over time.
Thank you. I think one thing, I'll just add a little bit of commentary. I know I'm not the feature here, but when I have Shadow Nurse, either through our beta testing, which we can talk more about, or just on, before shadow nursing was even a thing, just with my own friends and family. The format through which I've done that and through which Shadow Nurse has adopted for our testing and up until now is primarily just texting. And honestly, even though I had a number of people I was shadow nursing for, it just felt like texting my friends. They really became like embedded in kind of my life as just as a simple, normal thing to do.
Yeah.
It wasn't burdensome or cumbersome, and it didn't feel like it was taking away from, eating into my life or things like that. Can you maybe just comment a little bit briefly on that in terms of text relationships and using technology to facilitate?
Yeah. Well, I believe we should be a text-based platform. I think that's the way communication is today. It's easier. I will respond to a text much more likely than a random number phone call. I hardly check my voicemails, and patients don't want another MyChart to sign into. Can guarantee you that. So we aim to embed ShadowNurse into, your Apple texts, your Android texts, whatever it is, and make it feel seamless to the patients, just like they're texting another family member. We want them to be blown away by how easy it is to get in contact with their shadow nurses. And that's where the technology will come in. I can sense some of you guys being like, well, I can't be getting a text at midnight. That's where the technology and the community, right, a very big number of professional expert shadow nurses come into play to support one another through the platform and to support our patients.
That's awesome. So I'm going to hit a question that came in earlier on in the chat. And actually first, and I'll just for now, I'm going to read them out as anonymous, and because we didn't really say that we'd be saying anybody's calling out people by name. So for the sake of today's meeting, we'll just kind of keep it anonymous. But have we received any pushback or any of the providers thinking, hey, you're kind of stepping on my toes, or what are you doing in my exam room virtually on the phone? Or how has that cropped up so far? And has it been a problem? How have we dealt with it, et cetera?
Yeah, sure. So we did beta testing. We had about 60 patients, and I would call in, and some of the shadow nurses early on would call in to medical visits. The patients would call us in. They would typically say, hey, I have a personal nurse that's helping me navigate my healthcare. Is it okay if I call in? So yeah, we were asking permission. Everybody said it was okay. There was one provider in Florida that required the patient to sign a HIPAA form. But then, we went on as usual with the medical visit. So we haven't had any pushback from beta. More recently, I had a patient, this was the first time that we were going to urgent care. So all the beta visits were specialists or primary care. This was urgent care. It was the first time that I had a doctor. I was still allowed to call in and do my thing, but she did say, I don't usually like other people being in my visits, that kind of mentality. And I just said, okay, well, but she allowed me to do that. We're going to run into that. I think we are. It really helps us when the patient is the one bringing us in, when they're saying, hey, this is something I want in my visit. And I think we need to lean into that. We will be leaning into that. I think at a larger scale, when shadow nurses are calling into more and more and more medical visits, we probably will see a shift. I anticipate a shift in how the providers think about shadow nurses. Once they see the value that we're bringing and see that their patients are doing better, that they're more adherent, that they show up, they have more better questions, or they're more prepared, I think they're going to really want us there. We saw that with beta, with patients that we had gone to multiple visits with. And I think I can just, that'll happen at scale once we start to grow.
Yeah, I think that just to dovetail on that too, there was definitely a phenomenon of us making appointments more efficient for providers, which they obviously crave because they don't have enough time as it is. And so for those patients that are poor historians, either through our pre-visit prep calls, making them more on point with the communication, or through our own kind of speaking up and advocacy in an appointment to kind of guide a patient's history or something, or even just report a patient's history, that seems to be a real benefit to the providers. And so yeah, Olivia, I think you're spot on with there will ultimately be a shift. In fact, wouldn't feel too far-fetched for me to at some point have a provider say like, okay, bring the patient in and make sure the shadow nurse is on the phone, because I want to talk to the shadow nurse. I want to get the download, and move on from there. So yeah, it's pretty exciting to think about that kind of a shift happening. And as far as stepping on toes or feeling like we're intervening too much. Olivia, what's it like to be a shadow nurse in a visit? Is it a lot of questions and jumping in and intervening, or is it mostly listening and occasionally saying something?
Good question. Seems like the flow, in the beginning, you listen and take notes and listen. Nurses are really great at picking up on how, and you can do this over the phone, on the tone, of the patient or the tone of the provider. If you can kind of sense based on the information being discussed as well, how complicated it is. And then toward the second part of the visit is where I really find myself speaking up more. There is some grace to it, just like any other nursing job when you're in a room with physicians or providers and patients, right? You phrase things a certain way, you ask questions, even though you might know the answer already. That's just the tap dance, that we're used to. And I think that'll go away slightly, as we kind of find our voice as shadow nurses in the visits. But yeah, it really depends on the patient. What is their health literacy? How much are they advocating for themselves? How much did the pre-visit, prepare them and they're kind of taking ownership? Or based on the provider too, how much detail do they go into? Are they asking the patient if they have questions or not? You will know your patient. So if you're talking about something and then you know that they don't understand, you're going to jump in, you're advocating for them, and that's your job. That's how they're going to get the best care possible. If there's something that you missed, can you repeat that dose of medication? You ask those questions because your other goal is to capture as much medical information as possible. When they leave the visit, you want to have 100% of medical detail ready to go. So I find it really, it's an art. And I think that you'll find that too. It's a fun art to be in a medical visit in the role of shadow nurse, where you're not there for the hospital, or the clinic. You're there for the patient. And that's really a new role for nurses in this way.
Great, thanks. We're getting a couple of questions in that are kind of more platform oriented. And so maybe let's take a little bit of a jump into the technology side. And I'll preface this so Olivia doesn't have to. We're still keeping a fair number of things under wraps, so we might just mention things without going into too much detail about some of that. But Olivia, what would you say about what can people expect, generally speaking, with our upcoming summer launch of the MVP, and maybe you can explain what that means, of our app and the technology behind it.
Sure. So typically, and part of my passion here is to, work with nurses that are interested in technology, and provide training and the language around this world, right? So if you already know it, great, but here's a little spiel. So in a startup, right, you're really bootstrapping. You typically start with, just ideation, right, with engineers, some sketches, like back of the napkin kind of stuff. And then you move into design. So we've completed our design process where it's not an interactive app. You're looking at pictures of what it'll look like on a cell phone or on a laptop and giving feedback to the engineers, and they iterate a bit on the functionality, the desired functionality of it. And then now we're in our MVP stage, which is really the very first actual coded build of our app. So we've completed the designs, we've all agreed on what this is going to look like and what we're going to kind of go to the app store with, if you will. And that's being built now. And we're a few weeks out from seeing that download. So you all will be able to go to the app store and download the Shadow Nurse app in a couple weeks, which is incredible to me. And that functionality is really going to be meant to engage nurses. It's really going to be aimed more at the nursing side of Shadow Nurse, less so on the patient side to start. Okay, so you can expect to have something to interact with, and that's our MVP, which is a minimum viable product. Okay, so we're trying to bring something to our customers, which Our customers, we typically define as nurses. The app is really built to support you to be a shadow nurse and, capture information, and become most efficient. Typically care navigators today in the traditional sense, so somebody employed by a hospital can serve, 20 to 30 patients a month. We aim to double, triple that in an efficient, satisfying way where you can have many, many, many patients and still provide exceptional service. And that's where the technology comes in. How do we make you, how do we enable you to be the nurses, right? What do nurses bring to the table that isn't documentation, right? Or things that are kind of more administrative. How do we enable you to be fully present in a medical visit, not distracted by having to type, for example? So our MVP a couple weeks out, really focused on the nurses, our customers, and bringing some sort of value to moving you forward in becoming a shadow nurse on the platform.
Great. And kind of dovetailing with that, so what we can expect this summer isn't going to be like the whole enchilada as far as like what shadow nurse is in our dreams, right? It's going to be something a little less than that, but something to get us started and iteration. Right. So you want to talk a little bit about the iterative process with technology or with apps and startups?
Sure. Yeah, so when we launch the MVP and we will have actual users, you all downloading the app, we'll be able to track user use, right? What are you clicking on? What are you using? What questions are coming in? We have some nurses already, our diehard original cohort of nurses. Love you guys. They have been waiting patiently to kind of be our guinea pigs, if you will, with using this app in the back end. So we're going to get feedback from them. And that information will be given to the engineers, and us as a team, and we'll decide what to do with it. Do we make tweaks here? Where are people getting hung up? And every step is it's very important, right? That we get right, even if it's something like what font do you use to put your username in, or where does the button go, for updating your profile kind of thing. I'm overly simplifying that, but most importantly is to build an app, and I had to learn this, it takes much longer than you think it would, right? Especially healthcare related, especially a marketplace. So the full app, where we'll be like, okay, shadow nurse is fully functional, up and running. It'll be a place where patients and nurses can connect, and where patients can request shadow nurses to be their care navigators, to provide shadow nursing. And that will be, several months from now. So it takes a long time.
Yeah, that's a good point. So we do really appreciate everybody's patience and following us along on the journey. And we're somewhere still in the journey. And iterations don't only just bring fixes to bugs, but also bring new features and new exciting things to the platform. So Olivia and I have a mental map of like this massive, like shadow nurse being a massive thing, and what we're going to start with is just kind of this little corner of it. So not to make it sound underwhelming, because I think it's going to be pretty magnificent, but we're this far into a journey that's this big. So and y'all have a chance to really be, you already are, you've already declared yourselves as being kind of at the leading edge of that. So that's pretty darn cool. Let's see. What are we doing about patients? We haven't really talked about patients much in terms of who might be interested in having a shadow nurse. How would they find us? Are we going to help support the shadow nurses in bringing patients to them? I'm weaving a number of questions together here, but can you kind of focus a little bit more on the patients, and if the patients aren't really the focus right now, why is that, and when does that happen?
Mm-hmm. Yeah, we've begun comparing ourselves to Uber a lot. So Uber couldn't, provide a ride share service without taxi drivers, right? Like they could have been like, oh, do you need a ride somewhere to the person on the corner, right? But without a driver, there's no service. So we decided to focus, on the nurses and ensuring a lot of things, right? That you're not only is the app ready to go and to support you, but training. And a lot of what the newsletter and the premium service is about is to begin creating this coursework, if you will, this robust training to position you to become a shadow nurse on the platform. So what tools do you need to do that? Is it the phone on your dashboard? How do you interact with the phone when you're, getting a request from somebody that needs a ride? How do you accept and decline requests? How much does it cost? What do you set your rates at? Is the shadow nurse company paying me, something, or, all those features, right? If you think about Uber, all of that is about creating an ecosystem to support you to provide the best shadow nursing possible. So patients will ultimately go on our platform just like you do and be able to search for a shadow nurse that resonates with them. We will have some algorithms that help with that identification. You can imagine things like language, right? Ideally, we have shadow nurses that can speak many, many languages across the platform so that we can help people that way. Region or town or community can be helpful as well because the healthcare system environment within your community. Background, if somebody does have a back issue, do you have a pain management background? Those sorts of things can help pair patients with nurses. Health insurance, right? Or HSA and FSA might be a factor as well. So all of this is going to be part of how patients, choose and come to the platform and find nurses to help them. Marketing is going to be really big. Jeff and I talk a lot about that as well. It's kind of like Uber, right? Once we all knew about it, it was a simple download on your phone and go to town. But marketing is going to be a big part of this. We are creating it's something new. And with anything brand new to society, right? It's going to take education to the patients and the providers and the nurses. It's going to take, an awareness campaign, right? To the clinics and the healthcare systems, wherever we want to market to. And once we get that shadow nurse to become this ubiquitous term that this is what you want in your medical visit, then the patients will be requesting that.
So we one more question to kind of pair to that, and then I have a final question, and then we can wrap up in the interest of everybody's time on a Monday afternoon. So the question related to the one you were just addressing is we will be, in essence, we will be doing marketing. You can maybe clarify that, but also there's an opportunity for shadow nurses to bring in their own patients if they have some already earmarked or no clients. Do you want to just briefly touch on that, and then I'll wrap up with the last question?
Yeah, you can absolutely bring your own patients and your own patient panel to the platform, 100%. We actually think that there's a big superpower in nursing as a community, as a group. We know, for every one nurse, 10 that are really, really close to you that you could probably text and tell them about this today. And then every nurse has about 5 patients, whether they're friends, family, or, patients you've helped that you feel comfortable reaching out to. So there's kind of a grassroots, marketing effect that we believe will happen. You can absolutely bring your own patients to the platform when we launch. Marketing, when I talk about marketing, I talk about the company Shadow Nurse Marketing. I don't anticipate and I don't want to put pressure on nurses to market themselves. The platform should will be designed to market you, as a person to the patients on the platform. Broader marketing, like the billboards on the highways or, the website and ads and things like that, that will all be done by Shadow Nurse, the company.
Awesome. Okay, so we're going to wrap up with one last question. I'm going to do a quick shout out just for another another question that just came in terms of like, how does the flow of money happen and all that? That's a great topic for another.
Yeah, we should do a whole topic on that. Yep, whole
100%,
chat.
100%. So good question. There are a number of topics that we've just literally dipped our toe in the water on today that you probably are going to go home and think, 100 questions about, and we are going to address all those over time through the communications, emails, newsletters, and more of these chats if you thought this was helpful. So last question is, let's take it real deep into the tech. Let's go Silicon Valley on this and talk a little bit about, people hear the word AI and they hear technology and they think, how is that good? Is that bad? How does that fit into a role like this? How do we envision that? Should people be kind of afraid of that or embrace that? Or is it going to replace nurses? Like what's up with that piece of technology? And this will carry us to the end, and then we'll say goodbye at the end.
Okay, this is another hour-long conversation.
Just dip your toe in the water.
Well, what I think the beauty of shadow nurses, which is very apropos, I think. Nursing, we know, is just fundamentally rooted in being a human being. Like nursing, when you hold a patient's hand or you call them at a time of need, or you just give them a warm, good morning or something over text as a shadow nurse, you're really brightening that person's day and bringing the level of caring that AI can't do yet. I hope you guys are reading the stuff that I post on LinkedIn. It is such a debate right now. Things are changing every single day, but I fundamentally believe that human nurses can't be replaced. I think that if we do what we say and what we believe we can do, AI will augment what we do in a way that enables us to care for hundreds of patients at a level that is as good as how we can care for one. Multiply that by hundreds by using AI to augment that. We can't predict what's going to happen with AI, but I'd rather be in it and driving the research, the technology, the build, and working alongside all of you to make sure that we're harnessing it and using it in the best way for our patients, than just letting it happen on the outside, of my practice. So I think what the goal is to amplify us as nurses and use AI to augment that in a way that helps more and more and more people across the world. But we are going to be at the forefront of that conversation, and I'm excited to share that with you all.
Awesome. Thank you, Olivia. I think I can speak for all of us and say we appreciate you spending some time with everybody today, and hopefully we'll do more and more of this. So we'll wrap up today by just saying thank you, and pay attention to what's coming at you from our premium editions of newsletters and emails, and follow us and keep chiming in on LinkedIn. That's another hotbed for us. And yeah, we're just a couple of humans over here trying to make the world a little better place for you and the patients that we serve. So please give us your input. We appreciate the feedback. Yeah, and we look forward to seeing you next time. Thank you so much for joining today. I'm going to close.
Thank you all.
Thanks.
All right.